Hello, MenteSano community. Welcome back to our channel. Today we're peeling back the layers of a widely held belief. Just because you do XY doesn't mean you have OCD. This statement, while seemingly simple, is packed with meaning that we'll unpack over the course of this video. We'll dive into the complexities of obsessive-compulsive disorder, debunking common misconceptions that often cloud our understanding. So if you're ready for an enlightening journey, let's get started. In this video, we'll unravel the meaning behind this statement and debunk common stereotypes associated with obsessive-compulsive disorder. Firstly, it's crucial to understand what OCD is. Obsessive-compulsive disorder, or OCD, is not just a quirk or a character trait. It's a mental health condition that features two key elements: obsessions and compulsions. Obsessions are persistent, unwanted thoughts, images, or impulses that can cause significant distress. They're not simply excessive worries about real-life problems, but often irrational fears or discomforting thoughts that the person finds hard to control. On the other hand, compulsions are repetitive behaviors or mental acts that the person feels driven to perform in response to an obsession. They're intended to prevent or reduce distress, or prevent some dreaded event or situation. However, these compulsions are not connected in a realistic way to what they're designed to neutralize or prevent, or they're clearly excessive. However, it's essential to recognize that OCD is highly individual and manifests in diverse ways. It's not a one-size-fits-all condition and doesn't look the same for everyone. Contrary to popular belief, OCD isn't always linked to cleanliness or order. This mental health condition is as diverse as the individuals it affects, with obsessions and compulsions taking on a myriad of forms. Some people may experience intrusive thoughts about causing harm to loved ones or obsess over moral or religious ideas. Others may struggle with hoarding obsessions or feel compelled to perform mental rituals like counting or repeating phrases. Yet the common thread among all these experiences is the distress and disruption they cause. It's not just about having peculiar habits or preferences, it's about the time-consuming nature of these thoughts and behaviors, the inability to control them despite their negative impact. That's where the real challenge of OCD lies. So let's dispel the stereotype that OCD is all about cleanliness and orderliness. Let's understand that it's a complex, multifaceted condition that varies greatly from person to person. It's a mental health condition that requires empathy, understanding, and appropriate support. So why do we say just because you do XY doesn't mean you have OCD? Well, it's simple. Engaging in certain behaviors does not automatically imply a clinical diagnosis. It's all about context, the distress it causes, and whether it interferes with daily functioning. The misconception that ritualistic behaviors or obsessive thoughts always mean OCD can lead to misunderstanding and even misdiagnosis. It's important to remember that everyone has habits and routines, but not all of them are indicative of OCD. Now, if you or someone you know is grappling with obsessive thoughts or compulsive behaviors that are causing distress or impacting daily life, it's crucial to seek professional help. Mental health professionals can provide an accurate diagnosis and guide you toward effective treatment options. But it's not just about understanding OCD. It's about fostering empathy and support for individuals living with it. We need to debunk stereotypes and embrace the diversity of OCD experiences. Only then can we build a compassionate and supportive community where people feel understood and not judged. Remember, mental health matters, and so do you. Your experiences, your struggles, your victories, they all matter. You're not alone in this journey, and there's help available for you. Thank you for joining us today in dispelling common misconceptions about OCD. We hope this video has been helpful and enlightening. Remember, mental health matters, and so do you. Thank you for joining us. See you in the next video.